Hello, I'm Dr. John Abebe, the Medical Director of the Georgia Abebe Fertility Center and the lead tutor at the Georgia Fertility Academy. Welcome to the Basic Fertility Training Program for doctors and welcome to the Module 1 of this program. In this module, we'll be looking at Introduction to Reproductive Medicine and Fertility. And under this module, we have 3 units. We'll be going through the overview of reproductive medicine, understanding fertility and infertility, and the role and responsibility of physicians in fertility care. Now, under the overview of reproductive medicine, we'll look at definition and scope of reproductive medicine, and then dive into the history and evolution of fertility treatment, and then look at the importance of reproductive health in overall wellness. And then looking at understanding fertility and infertility, we'll look at the definitions of fertility and infertility. We'll look at the epidemiology and the prevalence of infertility. And then lastly, look at the psychological, social, and economic impact of infertility. And lastly, under the roles and responsibilities of physicians in fertility care, we're looking at the scope of practice for different medical specialties, the interdisciplinary collaboration with other healthcare professionals, and then the ethical and legal considerations in fertility treatment. So these are all the different units and subtopics that we'll be going through under this module, Introduction to Reproductive Medicine and Fertility. What is the learning objective of this module? This module will provide a foundational understanding of reproductive medicine and its scope, the definition of fertility and infertility, the historical development of fertility treatments, and the roles and responsibility of physicians in fertility care. It will also cover the physiosocial impact of infertility and the ethical and legal considerations involved in fertility treatment. It is hoped that having gone through all of this, the learning objectives can be summarized under 1. Overview of reproductive medicine, understand the scope, history, and significance of reproductive medicine in overall health. 2, fertility and infertility, recognize the definition, prevalence, and the psychosocial impact of fertility and infertility. And 3, the roles and responsibility in fertility care, grasp the scope of practice of various specialties involved in fertility care, the importance of interdisciplinary collaboration, and the ethical and legal considerations in reproductive medicine. That is the learning objective, and we hope that having gone through all of these, you would have been sufficiently introduced to the field of reproductive medicine and fertility. So, do have a wonderful time going through this module, and I see you in module 2. Bye.